Okay, I want to take a chance to explain some instructions for after you have a tooth extracted. I will also mention some additional instructions in case you had a bone graft or an implant placed, because a lot of the same rules apply. This is a sheet on the instructions following an extraction. We also have one on our website following an implant placement and additional instructions with bone graft. So I'm just going to summarize these. I'm not going to read the whole thing, but in general, when you get a tooth extracted, you're going to be very sore for about 10 days, and there's going to be a little hole where that tooth was. We ask that you don't eat anything really spicy, don't eat anything really chewy or like pretzels or M&Ms that could get stuck in the extraction site, and be very careful brushing around that extraction site. The three most important things we talk about are the 3 S's. These things can lead to a painful dry socket, which many people may be familiar with what a dry socket is. We say no sucking through a straw. So if you're going to have a milkshake, that's great, but try to eat it with a spoon or drink it, because the suction motion can pull the clot out and lead to the extraction site not healing properly. Second thing we say is no spitting forcefully. The spitting motion can also pull that clot out of the extraction site. And third of all, we would ask that you don't smoke. Okay, smoking is going to really delay the healing. It delays the blood flow to the area and can also cause a dry socket. So those are the 3 big ones. Take your medications as prescribed. You're always going to be on an antibiotic. For pain, ibuprofen is the best thing you could take. If you need to, you can mix it with Tylenol. So those are the 2 things we recommend there. We try to avoid narcotics at all costs, because narcotics are actually less effective in reducing pain than over-the-counter meds such as ibuprofen and Tylenol. A lot of people don't understand that, but that's what all pharmacists will tell you. Sutures, if you had sutures placed, we'll take those out in about 10 days. I always like to see patients within 7 to 10 days after an extraction to make sure things are healing as normally. And finally, just watch out if you have any allergies to the medicine. Please let us know right away, or if you start breaking out in hives or something, go to the hospital. If you had a bone graft placed, don't worry if little pieces of the bone graft kind of fall out. As long as a huge chunk of it doesn't come out, we're okay. And that, I've never had that happen, so we're not too concerned about that. The stitches will hold the bone graft in place, and you're going to also want to be very careful brushing, flossing around those areas. This goes for extraction. Also, I forgot to mention, no vigorous swishing. So if you're going to swish with warm salt water after 24 to 48 hours, that's recommended. In fact, after 48 hours, we say rinse 4 to 5 times a day with warm salt water. It'll help promote healing and accelerate healing and keep the area nice and clean, disinfected. Finally, if you had an implant placed, we're going to have you rinse with warm salt water for the first 72 hours. Following that, there's a prescription mouth rinse called Paradex that we give you. This is an antibacterial mouth rinse. You're going to swish with that twice a day for 60 seconds. Again, not forcefully swishing, but swish and get it all around to kill some of the bacteria in your mouth, and let that fall out of your mouth. Don't spit too hard. And an additional step to keep the implant site clean is take a Q-tip, dip it in some of this antibacterial rinse, and brush around the area with that to get rid of plaque and debris. That's all the instructions we have. If you have any additional questions, please call us. And for additional information, look at the handouts or go to our website. That can answer a lot of questions. This isn't meant to be every instruction under the sun, but it's a good overview.